Hello everyone, welcome back to OCD Recovery's YouTube channel. Before I go any further, you could please subscribe down below. Lots of great videos going up all the time. But today I want to talk about a video that Rob wanted me to do called Chasing Exposures, particularly pertaining to sensory motor and or somatic OCD, which is the same thing, just hyper-awareness. Let's say usually a breathing, swallowing, blinking, salivating, the bridge of your nose, any hyper-awareness of a body part. But I'm also going to correlate that with chasing exposures for symptom relief in the short term for any type of anxiety symptom. 5 days ago, I did a video called basically how to deal with uncomfortable sensations and why you're scared of them. It got a lot of great feedback. I did a follow-up video that isn't up yet, which is correlated to the fear of anxiety being there forever and why that fear kind of tends to linger for a lot of people and what seemed to work for me and what do I don't think works for a lot of people, whether it's an OCD sufferer or not. But today we're going to talk about chasing exposures. And I am going to basically talk about many different things, but I'll correlate it more toward sensory motor and physical symptoms of anxiety. So in the beginning of OCD, when you chronically latch, you always hear us talking about OCD latching and almost like a light switch, right? So basically, when you have chronic OCD and it latches in that format, the chances of you not having OCD in the subclinical level just before it clinically latched, where it takes over all your life 24/7, is, in my opinion, not possible. You have multiple different things leading up to expressing more than likely the genetic component of OCD. So one of my favorite quotes is, genes load the gun, genetics load the gun, and environment and lifestyle factors pull the trigger. This isn't just true for OCD. It's also true for, say, oncology and cancer research with BRA gene for breast cancer. Not all women partake in environment and lifestyle factors that express the gene. So, but with OCD, it's a little bit different because we know more about what not to do to, keep our chances down from getting cancer. You can't completely cut it out because healthy people do get cancer. It does happen. But, we don't know about this type of stuff. As Paul David said perfectly, if you break your leg, you don't jump on your leg all day saying to yourself, well, I'm going to get my leg to get better right now. But what we do with anxiety disorders such as PTSD, GAD, OCD, any of the basically anxiety-based problems is that we jump on it immediately and we say to ourselves, we got to get this better right now. Instead of if we were taught this when we were younger, maybe it wouldn't be as significant as it is because we just don't know about it. Probably because it's highly correlated with discomfort. Kirsty talked about that the other day in her video. She said, it's understandable why you wouldn't want to feel this way and why you would do compulsions. Humans like comfort. So we know that when we look at the gold standards for obsessive compulsive disorder recovery, so we have CBT, REBT. REBT was a precursor to CBT. I believe Aaron Beck properly was really the godfather of cognitive behavioral therapy. Albert Ellis as well, but Ellis is more known for founding REBT in 1955 when he started actually putting it into practice a few years later and then using it for the next 6 decades. So those two are gold standards. We know moving with uncertainty is key. We also know ERP is very important, exposure response prevention. So what does that mean? You expose yourself to anything in life. It doesn't need to just be OCD. And then you might have a response that you usually can lead to an avoidance behavior or compulsive behavior, whether it's OCD or not. But the goal is to decrease that response and sit with the discomfort and show yourself there's nothing to be scared of. So what happens is along the way for certain people is they start to chase exposures. And as Kirsty said in her last video, anything can really become compulsive. It doesn't need to just be the things that we typically think of, would say harm OCD, typically hiding knives and stuff like that. The outward compulsions, contamination OCD, using a cloth to grab a doorknob, or the stuff that a lot of people are aware of in those common forms of OCD. Common as I mean notoriety-wise to the general public. So, what happens is let's say you do an exposure, okay? And let's use somatic OCD. So let's say your exposure is going to a place you've been avoiding, such as the gym, because when you're breathing heavily and you're working out, you notice your breath a little bit more. So your respiratory rates are up a little bit than what they usually are. Your pulse is higher, your blood pressure goes up a little bit. All the physiologic things that happen when you're working out. But what's interesting is people will do that exposure, they'll feel good, and then some people will say, well, I'm going to go to the gym 7 days a week because I feel amazing when I'm there. Well, this can be a problem because you could start chasing those exposures. And it doesn't just need to be chasing the actual direct exposure. And with somatic OCD and physical symptoms of anxiety, exposures aren't as clear cut in the outward sense as contamination, harm OCD, where you're actually hiding things and moving things around physically and not touching doorknobs and stuff like that. Not that they don't have other mental compulsions like the internal thermometer we always talk about. With somatic OCD, I tend to hear information that isn't particularly correct. From my own experience, I don't think it actually works. You don't need to forcefully go out there and check and look for exposures. And that's what makes people feel treatment resistant or stuck, because they say, well, look at contamination OCD. They just had to stop touching doorknobs and grade themselves. And they also usually need to work on their beliefs. The fear of contaminating, say, a loved one. You could touch all the doorknobs you want and go through that. But if you're still deathly afraid you're going to contaminate, say, your loved one and kill them, it probably won't release. But not for everyone, but a lot of people I'd have to assume. And with somatic OCD and physical manifestations of anxiety, it's so prominent and it feels like it's such a part of you, because it is. Breathing, swallowing, blinking, salivating, the bridge of your nose, sensations on your back, as Brianna talks about. Like these things are never going away. Not that the sensation awareness of your back is never going away, or not the noticing of your blinking is never going away, because everyone, blinks. These are physiologic functions. Everyone has a back. And as I always tell people, it's not the thing that's actually causing the discomfort, it's the belief about the thing. If your blinking was the reason why you were where you are, then everyone who blinked would be where you are. It just doesn't work out that clearly. Now, yes, you have a disorder and you're more prone to being stuck in certain scenarios, but the belief is the driving factor on why you're scared. Even if you know this, even if I was like this for the rest of my life, or it would definitely be uncomfortable. I'm not going to say it wouldn't be uncomfortable, but that drastic fear that you have correlated with it is really the main reason why it's really lingering in a way. So, chasing those exposures and chasing scenarios, well, the number one, like I said, when it comes to somatic OCD or comes to anxiety, is you can start chasing the places where you were the most scared of, and you start going back to them and you see some relief. You can start chasing the feeling. So you're not even so much chasing the exposure as you are chasing the feeling that is attached to the exposure. Well, I need to feel good. Let's go out there, get an exposure, get all the anxiety going, and then just get that peace. Well, that becomes a problem. I've seen people, coaches, therapists, anyone really that's working with OCD, whether they're licensed or not, in all realms of help, say that ERP cannot become compulsive. That's a misunderstanding. Anything can become compulsive. Clicking this pen like this can become compulsive. Anything can become compulsive, OCD related or not. I read a really good statistic. As many of you know, I like statistics. It was a study looking at human behavior. I can't remember what university it was out of, but they were finding up towards of 65% of humans have a compulsive behavior. Whether it's their phone, their laptop, pornography, drinking, drug use. So it's not just OCD related. So anything can really become compulsive. Disputing can become compulsive. So chasing the exposure of disputing, saying, oh, the epiphany moment, I feel great right now. And then, do you really feel that great, or are you kind of just chasing that disputing? This is why disputing is more of an art than it is a straightforward mechanism. Some people like to write down 10 to 15 minutes a day, further along in recovery. You might not need to journal as much. So it's just not as clear cut as those standard processes that a lot of people say. And I tend to say sometimes, I do tend to say that. And I do realize it's not as clear cut as that. But when you look at the exposures that are needed to make serious headway with physical manifestations of anxiety and somatic OCD, the real big ones, as I said, are the avoidance. You are blinking, you are breathing, you are salivating, and you're swallowing. You're doing these functions. You don't need to chase them. Now, I've had people ask me, well, would you focus on it 15 minutes a day? You're going to get kickback either way you go on this. I've read people make good arguments for saying that it's not needed. I've seen good arguments saying why it could be beneficial, but it could be chasing the exposure. If you're sitting in your bed for 15 minutes and you're focusing on your breathing and say a mindfulness meditation, but you're doing it with the purpose of wanting to rid yourself of how you're feeling, that's the issue. It's like journaling. Journaling can be compulsive or it cannot be compulsive. It's like video games for some people. It can be compulsive. It cannot be compulsive. What are you using it for? Are you using to escape a sensation? Most of the time in the beginning, when it comes to mindfulness meditation, somatic OCD, the physical symptoms of anxiety, it usually is, in my opinion. For myself, it definitely was. And for others I talk to that are really forceful about trying to force the mindfulness meditation or yoga or just general awareness, mindfulness and walking around. Mindfulness meditation / mindfulness / yoga / breathing techniques can definitely have some benefit. I tend to be pretty blunt and harsh on those just because I think that they're used the wrong way for most people from what I see anecdotally. But I do think they have merit. I'm not going to sit here and say mindfulness is useless because that's not true. But, I think in the way that people use it where they think, well, I'm just going to become mindful about something. As Dr. Albert Ellis says, being insightful usually doesn't change people. Momin was a great example of this. For the first year, he talked about in his 2-year recovery video how he was very mindful. He was very incentive into what he knew. His problems were, but he actually wasn't partaking in the not bringing down the avoidance behaviors. So anytime I talk to someone in the community, it's going to be a fine line between, what are your avoidance behaviors? Are you chasing a relief in multiple formats, whatever they're compulsions, things you don't think are compulsions right now that you kind of figure out along the way? The journey is very complex and messy and sticky. It's not it took me 14, 15 months to even realize some of my hidden small compulsions that were keeping me stuck, such as needing to watch a video and then needing to text someone and tell them I watched the video. Little types of conditional self-acceptance behaviors that I'm just even now starting to pick up on. It's not the way how people make it out to be. So, those sitting in bed, completely trying to focus on your symptoms, anxiety, trying to bring them down, because that's what people tell you. They say, well, just meditate and bring down those symptoms. Well, that doesn't work so simple if you have a disorder. Remember, it's called generalized anxiety disorder. That's a diagnosis that's commonly given out to people who do not have GAD. Not saying they aren't struggling with daily anxieties or stressors, but they're not chronically latched like Paul David was, or how I was, or any of the moderators in their own format, OCD, GAD, or PTSD related. So it's just not that straightforward. So again, those are the main ones. Looking at the avoidance behaviors, starting to partake back into life, and then trying to chase that feeling, grab it. You're trying to, it's like you grabbed it, you felt good, and then you don't want to let go of it. You're like, I'm never letting go of the way I feel right now. Well, that's a problem because now that you did that, you're more than likely going to feel like absolutely fucking garbage the next day. Not always, but because OCD has a mind of its own and it knows when you're trying to do that shit. If you're trying to force a sensation or a feeling, it usually doesn't work out in the best of our favor. So, yeah, that's that. That's what I wanted to talk about in this video, just the how and why we chase some of these sensations, how I did it. I would, for a long time, I was almost trying to become so mindful of my somatic OCD that if I just... I hear people ask me this, I just need to habituate to it. Get rid of the habituate terminology. You don't need to worry about that. Just what you got to worry about is looking at the core fear, fear of being stuck forever, as I always cover, and fear of it ruining your life, and then working towards the avoidance behaviors. Those are the big ones, stop avoiding places because you're anxious, or the safety behaviors you have in your mind that keep you stuck. So I hope this video helped. My next video I will be doing more than likely is what to do during high moments of panic. I've kind of done maybe 2 videos on this, but I will be redoing it, and I will be redoing a really big sleep video. So for people, so if you're excited about fears associated with sleep and some of the irrational beliefs that society holds about sleep, I will definitely be doing a video like that. Thank you so much for watching and have a great day.